important because we're going to be using a backup airway either way. Are we really going to wait for the time for sucks to wear off, or are we going to place a king airway, or look at our alternative methods? Or are we going to sit there and bag them, hoping that the sucks is going to wear off and they're going to come back? So the
That's another
time
good
date
point.
and the duration debate is, not time date, sorry, the rocuronium versus sucks debate is kind of, or the non-depolarizing versus the depolarizing.
It still can be an issue if you've picked a patient who has a difficult airway, and even with the backup airway that you pick, you're having difficulty with.
Those backup
And
areas
that can,
fail.
and that can happen. You can have failure, and well, the combi tube actually is a really interesting device because do you know what the number one thing that it causes, the number one side effect that when they studied it from using the combi tube in somebody?
I know Norge doesn't like to use it because studies have shown that it decreases blood flow to the brain.
There's some people,
Because it
yep,
causes-
they're thinking that, but the number one thing that when they studied, in Dane County they studied it, and I think they studied around the country, was it tends to cause esophageal tear almost always. Because it's like, we used to call it, the joke we called it was the sword of death. Because it tends to be fairly stiff, and if you get in any kind of temperature deviation where it's a little cold outside, then the thing gets even stiffer and it's not very flexible to begin with. And most people, when they put it in, if you've watched a lot of people who are nervous and in a big fat hurry, what do? They literally ram it as hard as they can down in there, and it causes esophageal tear. And so that they find, then they wonder why their resuscitation was not successful, and it's usually because you tore the esophagus and now you have a big bleed going on along with your airway problem. So, and then it doesn't seal the esophagus off, and that's the number one problem with it.
But these are still patients that they needed to be RSI'd, so once they come back around, you know, is bag belt mass ventilations, or do you support their own airway anyway? You know, there was a reason we RSI'd them to begin with in the pre-hospital setting.
Right. And you hope that everybody makes really good decisions about how
Yeah.
difficult the airway is, but you're going to get caught once in a while. You're going to think that maybe this airway isn't that difficult.
Well, and that's,
And then you're
does
going to have
talk
an issue
about,
with it.
you know, new paramedics versus experienced paramedics and the decision making also, but they were just really good.
Yep. That's my book, and it's excellent. They also have a companion website with it if you guys want to look
We
at it.
used rocuronium down south, and I kind of always wondered why with the long durations. And
As induction?
yes,
Oh, really? Okay, that's interesting.
but that was the only agent we used.
Probably the favorite of the medical director, and hey, good luck with it.
This is the one that every time that I participated in RSI at Spooner, this is what they use.
Meconium?
Is rock. Yeah.
Rock, yeah.
For induction?
Yeah.
Used it for
Yeah.
induction, huh?
Yeah.
It's a benefit of only using
It
one
must have been
medication
just a
also.
preference of the CRNA that.
Is it the female or the male?
No, the dude.
The dude.
The
What's his name?
dude.
Tim.
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 Yeah.
Yeah.
Tim uses it all the time.
Yeah.
I like him.
Yeah, he's pretty